Let's bring in the head of Oyo State Isolation Centers, Professor Tope Alonge, to better understand the state government's effort at this time. Thank you, Professor, for joining us at this hour. Well, how true is it that Oyo State government hasn't done enough to curb the spread of coronavirus?
I believe very strongly that the Oyo State government has approached the containment and management of these patients in a holistic manner. Apart from having 8 thematic areas that was streamlined from the beginning, the last bit of it is actually the isolation center and then the treatment center to Ludo. The initial concept was to ensure that we have a lot of surveillance and follow-up of contacts. But beyond that, there's a lot of advocacy in the marketplaces with the local governments, with the traditional rulers. And above that, when Olodo was about to commence about 4 weeks ago, all the professional associations in the medical field, the Nigerian Medical Association, the Association of Medical Lab Scientists, Nigerian Association of Nurses and Midwives, physiotherapists, clinical psychologists, were all invited to come and add value to what we had on board. And all of them came and made meaningful contributions, including the most senior category of the doctors, that's the Medical and Dental Consultant Association. For us, their inputs have been exceptionally amazing.
Okay.
But beyond that, we have actually discovered that a few of the additions that were put in the Olodo Center is far from beyond what obtains in many other locations. For instance, we have the chlorine shower, chlorine bath, chlorine tank, and the dosing tank for chlorine. All of this is in preparation for subsequent, or if you might say, other pandemics or epidemics. So we didn't just prepare Olodo Treatment Center for COVID-19. Beyond COVID-19, it's actually a big center that can be utilized.
I get your point, Professor Alonge. Beyond all this infrastructure, let's identify how many number of patients you have at the various isolation centers currently in Oyo State.
At the moment, there are 4 cases of patients, rather, at the University College Hospital Isolation Center. We have 2 at the Agbami Isolation Center at Jericho. Now, the concept of the Olodo Treatment Center is that when patients are under observation and they have no symptoms, they stay in the isolation centers and they are being looked after. However, when their symptoms now become apparent and they have what we refer to as severe or moderately severe disease requiring either supplementation of oxygen and other medications, then they come to Olodo for treatment.
Okay, just a minute, Professor Alonge. If there are only 4 patients in the isolation centers, NCDC says there are 16 cases in Oyo State. Are you suggesting that the 14 others have been discharged?
Right. What has happened is that of all the patients that are in isolation, 4 are in the University College Hospital, 2 at Agbami. That makes it 6. Now, we've discharged 4 of them, and the others are in home isolation.
Okay.
Now, patients are given the priority to stay in their homes if the conditions laid down by the NCDC is met by the client.
All right, very quickly, because we have just a few more seconds to spend on this interview, let's touch on the government's position that the state government has mandated the use of face masks for anyone who will be in the public in Oyo State. Is this implementation being backed up with provision of face masks for the people of Oyo State?
Well, if you go around the streets of Oyo State now, you will find people putting on all manners of face masks. Some of them are well sewn, some of them are not. What the government has done is to engage 100 tailors. They've gone through a testing to know the quality and the specification of the face masks, and those are going to be given to people free of charge. But some other people have actually gone beyond government by going ahead to begin to prepare the face mask themselves. And I think this is actually a welcome development, meaning that we have a lot of collaboration between the citizens and the government. So government is making thousands of face masks that will be distributed very soon.
Well, there's been a huge concern about the proximity between Oyo State and Lagos State, the later being the epicenter of the pandemic in Nigeria. The enemy, for instance, suggested earlier on for a total shutdown of the state where you are. We wish you all the best as you keep fighting this virus. Professor Temitope Alonge is the head of Oyo State Isolation Centers. Thank you for joining us tonight.